why North Korea is intriguing, intriguing of a country. It's isolated. A lot of people know about North Korea that way. We use data that was gathered with support from UN agencies. And this is the first visualization that we have. This used data from the 2008 census of North Korea, table 18. And we visualized the maternal mortality rate. And the reason why we chose this variable is because MMR is used extensively by a lot of organizations, like WHO, to kind of give an insight into the status of the health of the women in different countries. And MMR is defined as the number of women who die from pregnancy-related causes per 100,000 live births. And if you look at this visualization, it's a map of the DPRK. The provinces that are displayed here are coded in different colors depending on their level of MMR. At the top of the legend, the bar, the deep green, 85 to 90 of MMR, and the province with the highest maternal mortality rate is Giang, and it's in this area of the country, so kind of up north. Then the province with the lowest MMR, between 65 and 70, is actually the capital city, Pyongyang, so down here, more towards the southern part of the country. And I would encourage you to keep in mind this trend where the capital city seems to have a somewhat better health status compared to the rest of the country. And we took the same data, but we look at the percentage of maternal deaths in hospital. The other places that can have people dying at home and elsewhere, according to the data. So the hospital is only one category. And if we look at this data, the capital city, Pyongyang, down here, actually has the highest percentage of deaths at the hospital. And these three provinces, Yangon, South Hamgyong, and Kangwon, form a series of three provinces that seem to have lower percentage of deaths at the hospital. So what does it mean? We looked at the topography of the country to try to explain what is happening here. Up here, the bigger circle, represents the location of Giang. So if you remember, two visualizations ago, Giang is the province with the highest MMR. And the citizens happens to be at a place where the location is very mountainous. And our observation is, or our guess, I should say, is that maybe that location makes it difficult for the citizens of the country to get to the hospital. And so maybe that's the reason why we saw a high number of maternal deaths, but a low percentage of that actually happened at the hospital. Then the capital city, Pyongyang, enjoy a somewhat sea level kind of structure, so they have lower maternal mortality rate, but they have higher percentage of deaths at the hospital. And we think that maybe it even brings about a more important question that needs to be addressed, that is the quality of the health facilities in developing countries. Because even the capital city, Pyongyang, it is the lowest maternal mortality rate, and it's still between 65 and 70. That's still pretty high, and it's already the lowest in the country. And something needs to be done to address that issue. Then we have two more visualizations in this series, and I'm just going to go over them quickly. But the key idea is that we're going to see the same trend over and over again, where the capital city, Pyongyang, seems to have the better health status. This is chronic malnutrition in children, and the capital city, Pyongyang, has the lowest prevalence, whereas the province, Giang, has the highest. And it's interesting because if you look at this map, it seems like as the provinces get further away from the capital city, the prevalence of global chronic malnutrition seems to increase. And the global acute malnutrition seems to have the same trend as well, when the capital city has the lowest prevalence, and as you get further away from the capital city, the provinces seem to suffer worse conditions. This raises the questions of what is happening in North Korea, where the capital city is experiencing such much better conditions compared to the other provinces. And that is a question specific to the country. So that concludes my series of data visualization. from about North Korea.
Oh, and then you're going to show the interactive TV, or okay, yes, sure.
And the second series that I'm going to show is an interactive data visualization, and the data that I'm using come from the United Nations Millennium Development Goals in 2015. So the first variable that I was interested in is the percentage of the population that is suffering from undernourished condition. And this is a simple histogram. It's animated, so if I click the play button, you can see the histogram changes over the year. And something that I thought was interesting is we see this histogram is that back in 1991, we still had countries that fall in the category of 80 to 100% of population undernourished. But in a little bit, when this animation stops, the year 2015, here, we don't see any country in that 80 to 100% category anymore. We also don't see any country in the category of 60 to 80%. So what that means is that over the course of about 15 years, the status of the world has improved so that we don't have any country in the category between 60 and 100% of the population undernourished anymore, which is a good thing. Now the bad thing is, as late as the year 2015, we still have countries that fall into the category of 40 to 60%. 60% of the country population undernourished is a significant thing, and something should be done to address that issue. So those are the two key takeaways from this visualization. Then over here, I took the same variable, but I displayed it in a map of the world. And now the regions are colored based on their level of population undernourished from 0% to 100%. So the first thing that jumps out at you is probably that the region down here seems to be the region that suffered the most, and that happens to be Africa. And this is the year 2015. The viewers can actually change the slide of the year to observe the population undernourished over a 15-year course from 1990 to 2015. So I'm going to go back to the first year here, which is 1991. And we can see that the population of Africa seems to be suffering the most during that period. Then we have a few other countries, we have other countries in Asia that suffer as well, and some in South America. So those countries would need help. Then fast forward to the year most recently, the situation improved significantly. We only see, for the most part, we only see Africa and some country in Asia. Now, if the audience, if the viewer, I should say, is interested in looking into different regions, it's possible to zoom into different regions and look at these different countries to get an idea of what specific countries are in trouble. So if I'm interested in this little country right here, I can zoom in, I can click on it. It tells me that it's Central African Republic, and for the year 2015, the percentage of population undernourished was 47.7%, and so the pop-up window is helpful in that sense. Then, according to the 2015 SDG report from the United Nations, a lot of countries managed to climb out of poverty for some part of its population, but then the population kind of slipped back into poverty right away. And the reason is that poverty and hunger reduction in this case, go hand in hand with other factors such as education, access to sanitation facilities, clean water, that kind of thing. And so that's why I'm interested in showing the population not using improved sanitation facility. And the reason why there's a negative in there, not using improved sanitation facility, is because I'm interested in showing the countries that are in trouble. So the population not using improved sanitation facilities are displayed in circles. So these are the circle markers. And the bigger the circles, the lower the percentage of the population that has access to improved sanitation facility. So for example, I zoom in, I click on the circle, it tells me the countries is Ethiopia. The percentage of the population that has access to sanitation facility is 28%, which is pretty low. Now, what happens to countries like the United States and Canada, where the population that has access to clean water is pretty high? There's a dot here. It's so small that we can't really see it easily, and in fact, I can't really click on it because it's so small, and the reason is that the population that has access to clean sanitation facility in the state is so high that the circle is small, and that's a good thing because that's where we are right now. Another observation that we have is that if you look at the population having access to sanitation facility and the population undernourished, there seems to be a correlation between these two variables. So Africa seems to be the place where a lot of countries need help with their sanitation facility. It also seems to be the place where a lot of countries need help with the population undernourished. And so there seems to be a trend going on here, and I think that it's an important thing for research organizations and NGOs to look into when they create sustainable development programs in the future. And I would like to say that this interactive data visualization is not perfect. There are a lot of missing data, which I will talk a little bit about in the conclusion. But there are missing data, and some of the countries' names do not display correctly due to that issue. So this is not perfect. And that's the end of what I have to say.
Okay, any questions or comments to this couple of very, I think the dynamic TV, including the interactive with many countries across the world. Any questions or comments?
A general question
Okay.
Previous presentation. In your mind, why do you think Giang has the best health and compared to relative to the rest of the country? You know, like the lowest mortality rate.
You're asking why I thought that North Korea has.
No, like the city of Giang. Why do you think it has the best, the lowest rates?
Oh, it just.
Right, compared to the rest of the country.
Because due to the legend here, so the prevalence of the disease, prevalence of wasting in children, so the lighter the color, the lower the prevalence.
Is there a reason for that though? That's what I mean. Is it like, is there like healthier people there compared, or they have better access to facilities, or?
There's a couple of visualizations that our team created, which, by the way, I'm not the one who created this, but one of our team members did. There are a couple more visualizations that our team created in the past, and one of them that I'm not showing here shows the migration from provinces to other provinces, and you can see that a lot of citizens actually try to migrate to Pyongyang, which is the capital, and my guess is that the citizens of that capital has better access to health facilities. Maybe there's more money going in there. If the seat of power is where the leadership is, and so those are possible explanations why the health status is so different there. Seems like the citizens there experience a somewhat higher privilege level than the other provinces.
I think that particular interactive TV Giang mentioned is likely to be included in a paper that will be published.
It's next year.
Oh, it's next year. Okay, you're going to show that?
Yes.
Okay.
Spoilers.
It would be interesting to take that one further. It would be interesting to look at various hypothetical reasons as to why these measures are better in the capital area, such as an increased number of facilities, increased expenditure, and so one could actually graphically show, perhaps, or create a graphical manner of showing what these, whether a proposed hypothetical cause really seems to bear fruit in this case.
That's right. Yeah. Okay. Thank you. So let's. Oh, one more question.
I'm like the map with the upper one. I'm curious, is that seems to show the map over time. Is that possible? Is that a dynamic change over time?
Sorry, I'm not really clear.
Yes, is that possible? Is that change? Dynamic. Change over time. Is that kind of interactive function?
Oh, just like a histogram.
Yeah.
I tried to do that. It wasn't successful. So this one is not perfect. So it was possible for me to include a play, but like I did for the histogram.
Yeah.
But since I used R Shiny to do that, and every time that the time was changed, the map was redrawn, so it created this flashing effect that I couldn't figure out a way to fix. So that's why I didn't show you.
It's already.
But you got me there.